Initially, I sought medical attention because of I had some tingling in my arms and in my legs, and it just wasn't normal for a 29-year-old to feel like that.
He was short of breath on exertion. He had chest discomfort on exertion. He also had fatigue. And on physical examination, he had the typical systolic ejection murmur of aortic stenosis. He had a surface echo that suggested severe aortic stenosis, and then a transesophageal echo that showed that he had a unicuspid valve. Instead of having 3 cusps, or 2 as they had suspected he had earlier, he really had only 1. And that was very tightly blocked and very heavily calcified.
There was something obviously pretty wrong with my past history. I'd already had open heart surgery one time, so he hooked me up with Dr. Gerdish.
He had a valve repair when he was 15 years old, and they had operated on his congenitally abnormal aortic valve, getting it to work, but not permanently. They were able to kind of adjust it so that it would still work for a while.
And he was so electric about the onyx valve, and so I had to pick that. It was, it's the newest of the new, and I wanted something that would last, and because I want to live a long life.
At 28, up until not long before he presented to us, he was a pretty active guy, and clearly had the capacity to be active again, and has been very active since his surgery. And we wanted to be able to provide him with a valve that would last him the rest of his life.
It supposedly could last up to 30, 40 years, a whole lifetime.
I used the onyx valve for Mendel's heart surgery to replace his aortic valve. In fact, in the past decade or so, it's been essentially the exclusive valve that I've implanted.
Benefits from the onyx valve is it's a free-flowing valve. So you have less of a chance of getting any type of blood clots.
In the case of the onyx valve, it has that advantage of never wearing out because it's a mechanical valve. It has the advantage of having a pure carbon coating, less likely to have thrombus form on it. It has the advantage of having a flare to conduct blood in a laminar fashion. In addition, the leaflets of the onyx valve, when the valve opens, they become perfectly straight. It's the only valve that does that.
Know that the technology is there now that it wasn't there when I was a kid, and people with this heart disease, or with valve problems, they can have normal lives again.
Within 1 month, he was running. And now when I see him, he's always cheerful and happy and upbeat, running races. As a matter of fact, I saw him a few months ago, and he hurt his foot because he was running so much. So he has done remarkably. It's really a great success story.
We have the skill set, the wherewithal, system, and technology to manage all of it. And I think that becomes very evident when patients experience not only the heart valve center visit, but the time they spend at the heart center being treated for their heart valve disease.
It's an intense moment when you're 29 years old. You're pretty young, and the realization of things like that, it's a life or death deal. So you definitely want to feel comfortable with who's going to work on your heart.